Good afternoon, everyone, and welcome to our community virtual town hall presented by Inspira. I'm your host and moderator today, and my name is Dr. Al Cocoli. I'm one of the executive vice presidents. And I'd like to start by letting you know how very pleased we are that you're joining us this afternoon. A couple of housekeeping things. Many of you have already sent us many questions in advance, and for that we thank you. We will try to answer as many of those questions as we can at the end of the formal presentation. In addition to that, however, there is a Q&A button on your screen, and if you have a burning question that has not been answered for you yet and you would like more information, please feel free to type in that question. I will be receiving that, and I will ask those questions as they come in of our panelists. In addition to that, the registration link that you, the link that you came in with also gives us your information, which will allow us to send a recorded session of this afternoon's presentation back to you for your review further on. Now, to get started, I'd like to present to you my very esteemed panel. So I'm going to start with to my left. First, we have Miss Amy Mansue, who is President and CEO at Inspira Health. Next to her, we have Dr. Evelyn Balogun, who is the Medical Director of Employee Health, Occupational Health, and Urgent Care. Following that is Mr. Paul Lambrecht, who is our Vice President for Quality and Patient Safety. And finally, we have Dr. Ed Dix, who is the Director of Pharmacy. So to get us started this afternoon, I'm going to turn over to Ms. Amy Mansue.
Thank you, Dr. Coley. As Dr. Coley mentioned, we are so pleased to be able to offer this information to you and answer real-time information that actually is changing. Within the 24 hours that we just went through, there was an entirely significant change in the groups of people that are offered, and that's endemic of what we're facing, is that information is changing very quickly, and it's very important that while we provide this today, and we're very excited to do so, that you please make sure you continue to check the COVID-19 New Jersey website, because that will provide the latest and greatest information. So right now I'd like to present to Dr. Evelyn Balogun to get right into the vaccine information and begin to answer your questions. Dr. Balogun.
Thank you, Amy. So before I speak to the vaccine, I would recognize that two of the most impactful responses that we've had to date to the pandemic has been our adherence to safe behaviors. So please continue to practice those, and as well testing. We're here today to talk about the third front, which is that of vaccinations. As mentioned, there will be a Q&A at the end, and so you will have an opportunity to ask questions. However, before that, would like to highlight some key factors about the vaccine and give some more details around the two vaccines that are currently available for distribution. We know, here's what we know. We know that the vaccines are safe and effective. How do we know this? Approximately 10 million doses have already been administered in the United States. The Centers for Disease Control has a process for monitoring safety. It's called vSafe. That means that after you're vaccinated, the CDC would like you to register, and they then send you a monitoring text for approximately 5 days after the vaccine, and that allows you to report any side effects or safety concerns to the Centers for Disease Control. We also know that the vaccines, though they've been fast-tracked, and this is, of course, in response to the pandemic and the needs based on the pandemic, though they've been fast-tracked, in no way have there been shortcuts in the review process or safety and efficacy. And again, I would reference the fact that the CDC is monitoring any side effects for the 10 million doses that have been administered to date. We also know that the science and facts demonstrate that vaccines are safe and effective. We know this not just from the COVID vaccine, but we know this from various other vaccines that we have for other conditions and other illnesses. It's very important to discuss and recognize that as more people become immune to COVID vaccine, that only strengthens our ability to respond and really stop this pandemic. So this is the concept of herd immunity. Within a community, as more people become immune, either from past illness or from vaccination, as more people become more immune, it decreases the risk of person-to-person spread for future occurrences. So it is extremely important that we all do our part, have this type of dialogue, ask the questions that we need to get answered in terms of helping us to make our informed decision, and get vaccinated. And we also know that, in addition to the science and the conversations that we're going to have amongst families and communities, we know that this is an evolving process. Our goal is to get to the community not only information and vaccines as soon as possible, but also we remain committed to providing information as it becomes available. With that, I will turn the presentation to Dr. Dix.
Thank you, Dr. Balogun. So I'm going to talk to you about the two mRNA vaccines that have been authorized for use in the United States. The first one is the Pfizer-BioNTech vaccine. This vaccine is a 2-dose vaccine. You need to receive your first dose, and then you get your second dose 21 days later. Now, it's important to realize that just because you get vaccinated does not actually mean that you are immediately immune. Our bodies and our studies have shown that people begin to develop some type of immunity from COVID approximately 12 to 14 days after receive the first dose of either Moderna or the Pfizer vaccine. And then you get your maximum immunity about 7 days after your second dose. So Pfizer, that takes it to about day 28 to 29, 30. So about a month after you get your first dose is when we're going to see that maximum efficacy, which in Pfizer has been shown to be 95% effective. We do know that this efficacy has been shown in the clinical trials across all age groups, from 16 years of age all the way up to 85, as well as in patients who have chronic diseases. The second vaccine I want to talk about, the Moderna NIH vaccine, is also an mRNA vaccine. They are very similar in terms of how they are constructed and the components of what makes these vaccines up. It is also a 2-dose vaccine. You receive your first dose, and then the second dose is 28 days later. It is very important that people remember, just because you get that vaccine, we can't stop our social distancing, and we can't stop all the measures that we have in place and wearing masks, because you can still potentially transmit COVID. Say that coincidentally you were exposed to it prior to or right immediately after you receive your vaccine. Don't forget, you're not going to be, having any type of immunity till about 14 days after you get your first dose, and even at that time, it's only about 50% effective. So it's very crucial that we continue all of our social distancing efforts and make sure that we wear that mask. That's our job, to make sure we protect others, not just ourselves. I want to stress that the efficacy of these vaccines, they have been shown to be very, very effective. 94.5% for Moderna and 95% for Pfizer. This is a very high efficacy in the vaccine world. If we look at comparative vaccines, like our seasonal flu vaccine, we see that effectiveness is anywhere from 40 to 60%, and that changes from year to year. The measles, mumps, and rubella vaccine is only about 78% effective. And then if we look at our tetanus, diphtheria, and pertussis vaccines, they're only about 80 to 85% effective. Finally, our pneumonia vaccines, they range in efficacy from 60 to 70%. So as you can see, 95% is very good as compared or stacking up against our current existing vaccines. It's important to say and important to know that these vaccines are not interchangeable, even though they are both mRNA vaccines and that they are both able to stimulate the similar type of immunity. You cannot receive one dose of Pfizer and your second dose of Moderna, or vice versa. You must make sure that you receive the same vaccine manufacturer for both doses. In terms of what are some side effects that we can anticipate experiencing, it's important that everyone realize that you cannot contract COVID from these vaccines. None of the vaccines that are currently being studied contain any live virus of COVID. The mRNA vaccines contain actually no part of COVID whatsoever, so you cannot contract it from receiving the vaccine. In terms of side effects that we see with both of those vaccines, the Pfizer and the Moderna, you can see we see about 10% or less of patients could potentially experience common vaccine-related effects. Now, these effects could be such as an injection site pain where you receive your vaccine, fatigue, tiredness, feeling a little achy, fever, chills, and also potentially a headache. These are common vaccine side effects we see with all of our vaccines. So there's nothing that we've seen out of the ordinary for these for the COVID vaccines to date. This is not an unusual. These are very common side effects or reactions that people can receive, and you may see a little bit more of an enhanced effect after the second dose, which means that your body has actually developed immunity after the first dose. So you can absolutely take ibuprofen or Motrin, Tylenol if you're experiencing any of those side effects after you receive the vaccine. These effects have only been shown, have only been observed in about patients for about 12 to 24 hours, and then those effects go away. So that's good. It's very good that someone, if you do receive side effects, having them for 12 to 24 hours is a lot better than contracting COVID. So that's a very important point. There is also certain populations that we have limited data for. For an example, pregnant women. Well, the COVID vaccines were not directly studied in pregnant women. There were women that did become pregnant in between the 2-dose series. So we do have some limited information in those women who did become pregnant, and they have been all entered in registries, and they are being tracked for safety and efficacy as we speak. To date, there's been no identified issues in pregnant women who have received the vaccine. It has also been recommended by a lot of the experts and a lot of the societies that provide guidance and recommendation for pregnant women and lactating women that the vaccine should not be withheld from them, and they should have a discussion with their healthcare provider or OBGYN so that they can make an informed decision. It is recommended that we don't withhold these vaccines, especially for people who have a high risk of being exposed to COVID. So we want to make sure that people are aware of that information. The same goes for pregnant and for breastfeeding and lactating women. There's been no indications that anything could be transmitted to the baby from breastfeeding that could be any harmful. So that is also currently being investigated and being studied, and we're tracking all of those women who have been pregnant. And there have been a number of women who that actively are pregnant in our current vaccination efforts who are getting vaccinated, and we are able to track that information. So there are hundreds of women, thousands of women at this point that are pregnant and have received the vaccine. So as Dr. Balogun alluded to earlier, over 10 million doses have been given thus far, so we do have all the data points that we need. So again, this is a conversation you should have between you and your healthcare provider. In terms of children and infants, the vaccine has not been studied in this population. We do have data for 16 years and older, specifically for the Pfizer, and that Pfizer is authorized for 16 years of age and older, and they are currently actively working on designing clinical trials for studying in younger, as young as 12 years old, so between 12 and 15, and in the future they may even look at vaccinating even younger. So that is something to come in the horizon. We expect to see some more promising information with that as time goes on. So one of the keys that we need to focus on, and Dr. Balogun had mentioned this earlier, vaccines are very, very helpful. They are a great tool for us to combat germs, illnesses, pandemics. However, vaccines are only as good as for us as if people take them. Meaning, we need to develop herd immunity if we're going to actually get rid of COVID, or we are going to get it under control. And what herd immunity is when you have a large majority of a population that has become immune by being exposed to a germ or a disease, illness, and developing an immunity from it that way, or by getting vaccinated and then developing an immunity from it that way. Once you have that immunity and it's been spread across a good portion, ideally, 60 to 70% plus of a particular population, the virus can't transmit to other people because they've already been exposed to and are immune to the disease. So if you take away the host for the virus, it's not going to be able to continue to be rampant across our populations. We've seen a lot of successful campaign efforts. We've been able to eradicate smallpox throughout the world. This has been an active vaccination efforts that began way in the 1800s and continued all the way up through until as most recently, I believe, is the 1980s. And then polio was also an illness that we've been able to vaccinate, and we've been able to have actually cure polio in the United States, and we haven't had any cases of that in a long time. So these are all perfect examples of how vaccination efforts, mass vaccination efforts, can make a significant difference in our populations and help us overcome these pandemics and illnesses. In terms of, we have the CDC ACIP committee interim recommendations for the phases that we've been talking about. This has been in the press, and it's been constantly changing. We've been, over the last 24 hours, it's been a very fluid one, as we've seen that the United States is asking the states to allow them to start vaccinating 65 years of age and older. We want to tell you that the first phases that were rolled out on December 15th were specifically for healthcare workers and long-term care facility workers and residents. So those are two critical populations that have very high risk of contracting COVID and or being exposed to COVID. So that's why there was massive efforts to getting those two populations vaccinated first. And now we're at a phase where we're looking to vaccinate other people who are high risk for developing COVID and or having significant illness or disease from COVID. And that will be including frontline workers, 65 and older, your first responders, police, fire, EMS, and also people who have chronic diseases that are age 16 to 64. The next phase is going to be essential workers, which are important for public works, public health, even at the grocery store and food service level, manufacturing. Those are all going to be important people that need to get vaccinated. And then at the next phase we're going to see is the general population. So we're hopeful that we'll be able to get to the general population sometime after April, and as long as we continue our efforts in getting all those phases vaccinated in an organized and stepwise approach, we'll be able to get on our way to herd immunity. All right, and at this time I'm going to turn it back over to Dr. Baligan. Thank you.
Thank you, Dr. Dix. So two of the key words that I heard from your presentation was evolving and constantly changing. And honestly, that is just indicative of the large scale of this effort. There has never been as an attempt to mass vaccinate a proportion of the population, basically the world, in any past history. So this is a huge undertaking. Having provided now the science behind the vaccine, given an outline in terms of the phases, I'm sure everyone's wondering, where do I fit? And so this slide just shows the population categories. The first is the 1A, and that's mostly healthcare workers. That includes hospital workers, long-term care facility workers, folks working in dental offices, funeral homes, and pharmacies. 1B would be frontline essential workers. And as you can see there, it's the law enforcement and postal and others. And then 1B, in terms of adults at high risk, includes age 65 and over. And as Dr. Dix has alluded to, part of the recent changes includes opening the vaccination process to not only 65 and older, but also 65 and under, for those that have immunocompromised or other comorbidities. So there certainly will be more to come. This is a change in process, and as the information becomes available to us, we will certainly make sure to provide that to our patients and community. But the current risk categories or population categories is outlined on this slide. So if anyone has any specific questions about the categories, we can come to that during the question and answer session. That being said, we'll turn the presentation to Paul Lambrick.
Thank you, Dr. Baligan. Over the course of the past several weeks, Inspira has taken significant steps to implement a vaccination process that is both safe and efficient. We received our initial shipments of the Pfizer vaccine back on December the 17th and began immediately vaccinating on December the 18th. We have 2 points of distribution or pods established, one at our Mullica Hill campus and the other at our Vineland campus. As of midday yesterday, we have administered over 6,800 doses, and approximately 2,500 of those doses represent second dose administrations of individuals who have been previously vaccinated. As of this morning, we've begun to transition our points of distribution from a closed status, where we're focused on vaccinating those associated with the Inspira organization, over to an open status where we begin to vaccinate other healthcare providers in the community who may not have been able to be vaccinated at their primary place of employment, as well as extending the invitation to our first responders to begin and assist in their vaccination process. Given the announcement made yesterday by the governor expanding our vaccination efforts into the age 65 and over category, as of Monday, January the 18th, we will further expand our points of distribution to begin vaccinating those age 65 and older, as well as those age 16 to 64 who have a chronic medical condition which places them at a higher risk of a negative outcome from a COVID infection. As we make that transition, we will also be transitioning from a tent-based operation, which we have been using over the past several weeks to manage our employee population, into a trailer-based operation, which will provide us with a much more secure and environmentally friendly environment in which to vaccinate as we progress into the colder months. Having said all of this, our ability to provide vaccination is all contingent upon an ongoing supply of vaccine coming to us. So we monitor those supplies on a daily basis and continue to vaccinate with the available inventory that we have on hand. As of yesterday afternoon, we established an information line with pre-recorded information that anyone can call and get up-to-the-minute information as we know it today. So we have populated this number with information that is all relevant as of today, and as the conditions change going forward, new information is learned, we will update that recording so anyone can just call and try and get some of their questions answered. So the next step in the process is understanding how you can get in line, so to speak, to be vaccinated. And the first step that you need to take is to pre-register on the state's COVID vaccination website. The New Jersey Vaccine Scheduling System, or NJVSS, can be found online at covidvaccine.nj.gov. Once you access that site, you can pre-register, provide your basic demographic information, and you'll receive an email confirmation that you have been pre-registered. When your phase designation that Dr. Dix had just referenced in a prior slide is due for vaccination, you'll receive a notification again by email to go back into NJVSS and schedule your appointment. You'll have the opportunity to schedule your day and time based upon availability, as well as the site, the vaccination site that you wish to travel to receive your vaccination. If you experience any difficulty in registering using the NJVSS website, the state has established an access number, 211, that you can dial for assistance. Please be advised that under current conditions, they're experiencing heavy call volume, but it's another resource for you to reach out to if you have any questions. And finally, just to reiterate what both Dr. Dix and Dr. Balogun had alluded to in their parts of the presentation, vaccination does not take the place of the protective measures that we've been observing for the past year in trying to flatten the curve and control the spread of coronavirus. It will take some time for the population to be vaccinated and to achieve immunity. So during that time, we must bridge the gap. And the way we do that is adherence with the protective measures that we've been observing. Continuing to wear a mask is a critical step in this process, as is observing proper hand hygiene, using soap and water and hand sanitizer if soap and water is not available, and to practice physical distancing. Additionally, as organizations, we must continue to maintain and screen for the health of all those who enter our facilities, asking for a health status check and a temperature screening upon entry into our facilities. We encourage our workforce, and we encourage all of you, if you don't feel well, to stay home. Clinically, we'll leverage testing options that are available as appropriate. And then finally, we're going to continue to educate and communicate. As we've all said during the course of this presentation, managing COVID has been a very dynamic situation from the start. We continue to learn more about this disease every day and how we can combat it. So being aware of that, being able to educate and communicate that is key to our success. And with that, I'll turn the presentation back over to Amy.
At Inspira, our commitment is safety. That is our top priority. It's where it starts and where it ends. And many of you have asked me and others within the facility about the safety. Dr. Dix has taken you through the efficacy. And I want you to know that the people who got the vaccine first, the people who signed up before all others, were those nurses and physicians closest to COVID, seeing it every single day and knowing the devastation of this virus. This vaccine is one of the most important ways that we can get to the herd immunity that Dr. Baligan talked about. But we need people to take it. And as Paul indicated, we need a steady supply of that vaccine. The state of New Jersey has done a tremendous job of making sure the hospitals have the vaccine, but they are dependent upon the federal government to receive it. Please understand that as we go through this process, as we look to begin to vaccinate those individuals 65 and older and 16 to 64 who have comorbid conditions, there will be challenges with this. That many people being vaccinated all at once and making sure we have enough dosage is going to create a difficulty. Please follow the procedures that Paul just outlined. And the other thing I'm going to ask you for is patience. I know that colleagues have already had to reschedule patients because they didn't have enough dosage even after you had been scheduled. And please understand, we want this vaccine to get out as fast as you want it. So please be patient with it and understand that the most important thing for you to do right now as you await your vaccine is really focus on prevention. Make sure you're wearing your mask, you're washing your hands, you're remaining socially distanced. But we also know that people continue to ask about the testing itself. So let me take you through the community resources that we have available to test. On our website, we have a COVID-19 self-checker. So you can actually go in and look at the self-monitoring, being able to ask yourself some questions, understand where you might have been exposed. On our Inspira website, we have up-to-date information on COVID, which, as I mentioned, is literally changing from the moment we started this conversation on vaccines till probably the time we're off. So really use the website as that resource. And then the thing that we found in this pandemic that has been very helpful is the use of telehealth. Before March, we had done about 145 telehealth visits. Now we've done over 133,000 telehealth visits in the last 9 months, and it has been a tremendous resource. And you can use it to determine how to schedule your COVID-19 test. You can use it as a rapid referral for seeing the physicians. Now, again, your physician may not have time available, but that's the beauty of having telehealth, is being able to see whoever is available, and they will have access to your records. And also, most importantly, during these very stressful times, telehealth has been a tremendous improvement for our behavioral health program, really creating that easy access for people to be able to get behavioral health services. That means if you need to talk to somebody, if you're feeling the stress of the isolation that this virus can cause, or it just, quite honestly, the pressure of not having things the way they used to, please use our behavioral health program and know that it is available to you through telehealth. All of this can be accessed through the My Inspira app. We have our Rosie, which is our chat box, which allows you to ask questions and be navigated through our website. She can allow you to help with the COVID-19 assessment, and you can actually see that as one of the first points on the portal as you go into the My Inspira app. There is access to your own records through the patient portal and the Find Care Now. This will be an important place to be able to know which of our centers have been opened and which we've had to close, because we have had to make adjustments as our numbers continue to grow in our inpatient hospital to make sure that we can indeed meet all the people who need care. Now, we spent a lot of time talking about the COVID patients in our hospital, but let me also use this as a moment just to remind you, if indeed you're having a health condition of any kind and you feel the need to, an emergency basis to come on into the hospital, please do so. what we're seeing is that people are waiting too long, and by the time they get to the hospital, have a higher acuity, meaning they're sicker than they needed to be if they had come when they first felt that chest pain. Yesterday, I saw a statistic that probably worried me more than others. Our breast screening is 50% down year over year, 19 to 20. And we know that our best opportunity to be able to beat cancer is when we catch it early. So please make sure that you are accessing our telehealth program or your physician and having those conversations if you have any concern at all. It is really important to make sure that you keep up that access. And again, the website and the My Inspira app will help. We've given you a lot of information very quickly. I'm going to turn it back to Dr. Coley so we can start with the questions. Dr. Coley?
Thank you, Amy, and I want to thank all of our panelists for some great information. And boy, your questions have been flowing, so let's get right to it, shall we? I will throw these questions out to our panelists, and it will be a round of rapid fire. Dr. Dix, what are the side effects of both vaccines? I know you talked a little bit about that, and also, besides the Pfizer and Moderna vaccine, could you please talk to us about when we expect to see other vaccines being released?
Sure. Thank you, Dr. Coley. The side effects for both vaccines are very similar for what we see. They're very common vaccine-related side effects. So we see primarily injection site pain. It starts about 12 hours or the next day when you wake up, but it feels like you got a tetanus shot. And then about a half a day later, it completely disappears and your arm is back to normal. It's just a little bit of pain, and it's not really that bad. You can also develop some aches, some pains in your backs, your muscles, and potentially chills or fever. And a lot of people have complained of headache. Now, again, less than 10% of people who get the vaccine experience any of these types of side effects. And you may see some of those side effects more so after your second dose than after your first dose. In terms of vaccines and which ones will be available, well, this is a very evolving, fluid situation as well. There's over 77 COVID vaccines that are currently being studied throughout the world. In the United States, there's specifically 17 vaccine trials that are going on, and we have 7 that are either in or completed phase 3 clinical trials, and we have 2 authorized. So the next ones we foresee, the more front runners after we have Pfizer and Moderna right now. The next one we expect to see is the Johnson & Johnson to publish and share with us their efficacy and their safety data. And once that is available, they can potentially apply for an emergency use authorization to the FDA. After that, we have the Novavax vaccine. And then after that, AstraZeneca, which is being used in the United Kingdom. They are not looking to come for presenting their data to the United States till about April. That's about the most updated information that we have at this time.
Thank you, Dr. Dix. That was very valuable. So what I'm really hearing is that there are some side effects. Certainly people are being monitored for 15 minutes post-vaccine. So for those serious things that we worry about, you'll be watched immediately. And as has been said, there are things that you can watch for afterwards. The good news is we've already vaccinated or provided over 6,000 vaccines at Inspira to date. And there's only been a handful of people that we have actually even had to observe. So the good news is that the vaccine is relatively safe. The second good news is there's lots more vaccines in the pipeline. I'll move on to the next question, and this one is for you, Dr. Balogun. Is it safe for diabetics or people with MS to get vaccinated?
Thank you, Dr. Coley. Yes, the answer is yes. It is safe for diabetics and
People with MS. People with MS.
People with
MS.
multiple sclerosis as well to get vaccinated. There are actually no disease conditions that are contraindicated or listed as a contraindication to receiving the vaccine. And rather, the 2 conditions you mentioned and probably several others would be considered actually a risk factor for the illness and would more so indicate the group that should, as we alluded to in terms of the risk categorization, should get vaccinated, either because they're age 65 and over or they're under 65 years of age and they have been diagnosed with one of those conditions.
Thank you, Dr. Balogun. And as always, if you have any very specific concerns or you have a complicated medical history or things that you're unclear of, We've always asked and we always suggest that you speak to your physician. And to that end, Amy has also told you that we have capabilities of telemedicine and telehealth, as well as inpatient visits that you can have with our providers. So certainly, if you don't have a provider, this would be a good time to get one because you may have some questions. But in addition to that, if you are not sure or have concerns despite some of the things that you're hearing, please talk to your provider before you get your vaccine. Dr. Dix, this is another question that I'm seeing on our thread, and it's coming up often, so I think it's a good question for you. If somebody is prone to getting Bell's palsy with vaccines, there's a lot of concern about that having happened, and should they avoid the vaccine? Should they get the vaccine? What should they be doing? What's your advice?
So this is a very good question. This has come up not only just with vaccines, as some people may be prone to developing that from getting a vaccination. However, what we do know that in the clinical trials with both Pfizer and Moderna, there was a small percentage of patients, very, very small, I believe it was only 4 in each clinical trial, that developed Bell's palsy after getting vaccinated. That is actually not outside of the normal percentage of the United States population that actually has and can contract Bell's palsy. So there is absolutely no correlation that we've identified statistically or throughout the clinical trials that the vaccine can cause or result in Bell's palsy. Now, if you have Bell's palsy or you're in the midst of it and your symptoms have to first resolve before we would want somebody to actually get vaccinated. So that is an important point that we would like to get across.
Thank you, and that's definitely very helpful information. Along those same lines, I have another question that is threading through and has come up several times. So Dr. Baligan, if you could help us with this one, and this relates to people who carry an EpiPen and have had major arm swelling even with getting allergy shots. What should they be thinking about when they look to come and get their vaccine?
So with the issue of someone who has a current EpiPen or has a history of allergies, the guidance is that you really should, again, lead with a conversation with your provider. Being prescribed an EpiPen in and of itself does not exclude you from receiving the vaccine. The only criteria or only issue of concern is if you're known to have a specific allergy to a vaccine component. So if you have concerns, either because you've had multiple allergies and you're not sure what you're allergic to, it is best to lead with that conversation with your provider. The vaccine components are available on the Pfizer website, and certainly we would be also able to provide that. The primary conversation that's been had to date has been around polyethylene glycol, and polyethylene glycol can be found in cosmetics, can be found in certain medicines, can be found or has a component that's similar to IV contrast. So if you're not sure, but you've had allergies to any of those things, or you're just not sure, best to have that conversation with your provider. I will speak to the vaccine, our distribution or the site for how we vaccinate. We have patients come through and get registered and are provided the vaccine, and then are monitored for 15 to 30 minutes. We have EMS on site, so if someone does have a reaction, they're readily able to be cared for. However, again, the thought is that it's best to have a controlled conversation in a controlled setting with your provider. And if you have any further questions, I'm sure there'll be a way to push that through for us to send your provider whatever support and information that we have available.
Thank you very much, Dr. Baligan. And I'm going to ask you a follow-up question, which was a unique one that I hadn't heard before. And I certainly think I know the answer, but I'm going to ask it because probably there are other folks who have asked this question. And it has to do with blood type. Are there specific blood types that should go first? And is there any individual that is least affected versus most at risk based on blood type?
There have been no scientifically supported evidence to suggest that blood type either puts you at the front of the line in terms of vaccination or pushes you to the back. So the answer to that would be no. I know that early on in the pandemic, I came across maybe 1 or 2 articles, but they were not in scientific journals, that spoke to higher risk of COVID or severity of COVID illness with a blood type, but that was not published in a peer-reviewed journal. So really, I think what I would lead to then is what would put you at the front of the line or speak to someone being vaccinated would be those comorbidities that we spoke of, diabetes, a history of COPD, high blood pressure, heart disease. Those would be the sort of things that we would look for in terms of comorbidities, but blood type is not included in that categorization.
Well, I'm glad you cleared that up, and it was exactly as I thought. Paul, this next question is for you. There's, again, a lot of questions wanting to understand where the vaccine is available. Could you please underscore that for our viewers?
Certainly. Thanks, Dr. Coley. Both vaccines have been made available in varied quantities to healthcare organizations across the state, as well as local and county health departments and some other providers. In addition to that, the state of New Jersey has established 6 mega sites throughout the state, which have been designed specifically to be able to vaccinate large quantities, large volumes of people. The best source of information for anyone would be the state's website. If you navigate to covid19.nj.gov, you have ready access to information as far as pre-registering for the vaccine, who's eligible, how to get vaccinated. And when you actually log into NJVSS to register and schedule for an appointment, you will have ready access to everyone who has vaccine available and appointments for availability to be vaccinated.
Thank you, Paul. And a question that follows that is, do you get any documentation that confirms you've been vaccinated?
You do. So at the time you arrive for your first vaccination, you will be provided with a card that is printed by the CDC, which is essentially your vaccination record. So that will be completed for you at your first dose. Then when you schedule for your second dose, it's important for you to bring that card with you to have your information recorded for dose number 2. And then that essentially serves as your vaccination passport, so to speak, and shows proof that you've been vaccinated with the COVID vaccine.
Thank you. Amy, I see a lot of questions asking about the cost of the vaccine. And is the vaccine covered by insurance and Medicare, or is it free? Could you comment on that?
Sure. The vaccine is covered by insurance, and we will take your insurance information when you come, but that literally is only to ensure that we have record of it and for our own administrative process. There is no copay associated with it, and the vaccine is indeed covered. Again, the focus is on making sure you can get the vaccine, and if you say, well, I don't have insurance, you will still be able to get the vaccine.
Excellent. Thank you. Dr. Balogun, should you quarantine after you get the vaccine?
No, there's no guidance that requires quarantine after you get the vaccine. I think certainly some, as Dr. Dix has alluded to, some persons do report having side effects after, and so certainly if they have a local reaction in terms of arm soreness, or they have fatigue and they're not for that 24-hour or so, and they're unable to resume their usual function from a functionality standpoint, they may need to basically treat that treat those symptoms. However, there's no specific requirement for them to quarantine, nor is there a concern that they're infectious, which is usually what we are referencing when we say you have to quarantine. It's that there's some concern that you are infectious to others. But there's no concern that you're infectious to others after receiving the vaccine.
Excellent. Amy, the next question is from somebody who lives in an over 55 community. And the question pertains to the fact that there are at least, I believe, 500 people who would be eligible where they live. And the question is about whether or not we could come to their clubhouse to administer the vaccine, because there are many residents who might have trouble traveling.
Yeah, thank you, Dr. Coley. This is a very difficult thing to try and explain, and so I'll ask you to bear with me. When the Centers for Disease Control actually authorizes you to receive the vaccine, a couple things have to happen. you have to stay at that specific site where you've been authorized. And so our sites are Mullica Hill at the Inspira campus there, and our Vineland Regional Center. So those two sites are the locations that we can offer the vaccine. Now, this may change as the vaccine changes in reference to whether it can be stored differently. The Moderna vaccine and the Pfizer vaccine have different requirements. The Pfizer vaccine, which is the vaccine that we have, requires a sub-zero freezer, or -100 below Fahrenheit. And so, that is not something you can do just anywhere. This is not like a flu shot. It's not like you can bring 100 of them and stick everybody and leave. This requires an administration by a pharmacist of making sure that they actually draw the vial, and then can be administered by nurses or doctors, anybody clinically licensed, but then you have to be observed by somebody clinical for 15 minutes. That's required for every person, regardless of whether you have comorbid conditions or not. So we can't actually respond at this point to the over 55, or I know employers have asked as well if we can come to the sites and vaccinate all their employees. Again, I do expect that that will change as this goes on and this process goes on, and we are trying to think about how best to vaccinate those individuals who have trouble traveling. I have heard from individuals that they, in the mega sites, it might be difficult because there's so much area they have to cover in reference to walking. In our location, there's not that much area, but you will indeed have to manage some steps potentially with the trailer. And so we need to continue to work on those things, and we will indeed do that. But again, we are limited by those restrictions that I detailed.
Actually, all excellent points, Amy. And as we are all aware, the vaccine is also, in addition to the mega sites and healthcare organizations, being provided at certain grocery stores and storefronts where, again, if they can overcome some of those limitations. Remember also what Dr. Dix talked about. There are different vaccines that we have right now, and the requirements for storage for the Moderna vaccine and the Pfizer vaccine are a little bit different. So sometimes if you get confused with the who's doing what, it may actually be a function of the type of vaccine that they've been allotted. And so obviously everybody is doing the right thing, trying to keep everybody safe. So please bear with us, as Amy has suggested, as we continue to work through the process and improve our processes as we have done throughout this pandemic. Paul, I'm going to ask you a follow-up question, because many people still seem to have a lot of confusion about once they've registered for the vaccine. As we know, we've had an onslaught of people. There's actually over 1 million people who are currently registered on the New Jersey state site, and many are waiting to schedule that appointment. Could you remind us again as to, other than exercising patience, which I know all of us are having to do, what that process is going to look and feel like to the best of your knowledge?
Thank you, Dr. Coley. And yes, exercising patience is a critical part of this whole process right now. So once individuals log on to the New Jersey vaccination scheduling site at NJVSS, you will enter your demographic information. And once you complete that pre-registration process, you will receive an email confirmation that you have been pre-registered. And then at some point in the future, you will receive a subsequent email when your phase of vaccination comes due. So as we said earlier in the presentation, we are currently vaccinating in phase 1A, and the groups that have been included in phase 1A have modified slightly over the course of the past several weeks. So as additional populations become eligible, you will receive notification if you are in that population group that you can then go back into NJVSS and schedule your appointment. You can select your day and time based on availability, as well as the location at which you'd like to travel to have your vaccine completed. And then once you complete that scheduling process, you'll receive a confirmation that you're good to go to that site for your vaccination.
Thank you, Paul. Very helpful. Dr. Balogun, what happens if you don't get your second shot in either that 21 or 28-day framework as was outlined before?
Thank you, Dr. Coley. So the recommendation is that you should get it as soon as possible. As you mentioned, the interval between dose number 1 and 2 for Pfizer is 21 days, and for Moderna is 28 days. For whatever reason, a person finds themselves off schedule, the recommendation is get it as soon as you can. And I think that you should be fine. There are no additional requirements or recommendations beyond just making sure you get it as soon as you can.
Thank you. Dr. Dix, Dr. Balogun had spoken about the EpiPen and given our viewers some more information about that. I also see a number of questions that are interested in hearing about people who have either severe food or medication allergies, and does that have any impact on getting the vaccine?
Thank you, Dr. Coley. That's a very good question. So I want to be clear. There are no current medications that interact or interfere with the COVID vaccine. The same goes for people who have food allergies. What we do need to worry about, when I say medications, I'm talking about oral medications. We worry about anyone who has a previous reaction to an IV medication or something that contains the polyethylene glycol that Dr. Balogun had alluded to earlier. A lot of questions also come up. If I take an immunosuppressive drug for my disease state, is that also going to interfere with the COVID vaccine? And the answer is no, it's not going to. The way that your immune system works, if you have an immunosuppressive disease or if you're taking an immunosuppressive drug, it just makes your immune system not respond as robustly to that vaccine as it would be as another person who did not have that disease. So, for example, instead of getting 95% effectiveness after a month, you may only receive 70% effectiveness, which is still a very, very high amount. It's just the nature of your immunosuppressive disease.
Thank you, Dr. Dix. Here's a good question for you. Once you're vaccinated, can you still get COVID? And part two, if I'm still have the possibility of doing that, what are the benefits of getting vaccinated?
It's a very good question. So you cannot give COVID to someone just because you've been vaccinated. And in terms of, what was the second part of that question? I'm sorry.
The second part of that question was if you're vaccinated and I
you
lost
give
that
it to-
thread
can
again.
you give
Once
it
you're
to-
vaccinated, can you still get COVID? And if
Yes,
so, what are
correct.
the benefits of getting vaccinated?
So just because you get the vaccine doesn't mean you're going to instantaneously be immune. You need to develop that immunity, and even at the most effectiveness a month after you get that immunity, you're only going to be potentially 95%. So there is a potential that you could be an asymptomatic carrier. You may not contract it, but you could, however, be an asymptomatic carrier. So that is why it's very important that we continue to do our social distancing and wear our masks. And we're going to have to continue in that phase until we have herd immunity, and there's really people who the people who would be susceptible to developing COVID, as that number shrinks and our herd immunity grows, that's when we'll be able to go back to a more traditional pre-COVID period of time.
See, there are so many questions. You just can't ask me to ask you the same question twice because I've already moved on to the list of all the questions I have to ask. But moving on, and this is a good one too, and I'll keep with you, Dr. Dix. How long do the vaccines last once you get the vaccine? So in other words, what level of immunity can we find ourselves in? And if someone has had COVID, what kind of immunity can we expect there?
So it's a very good question that we don't have all the answers for. This is evolving. We have information that can show we're about 6 months and counting since the first clinical trial started with the Pfizer and the Moderna vaccines. So we know that at least for right now, the vaccines have been showing about 5 to 6 months worth of immunity. Same thing goes for COVID. If you develop or contract COVID, we have a lot of information that shows that they have immunity for up to 90 days, and in some instances even longer, up to 7 months, I believe, in some clinical trials. However, there, in very rare circumstances, people have actually contracted it again. So there's a lot of things that are unknown about COVID and the disease and why it affects certain people and why somebody may be more susceptible to receiving it or why their antibodies or their immune system doesn't provide immunity for that long of time. I mean, we are all different and everyone's immune system is different. But what we do know is as of right now, we have about 6 months protection of immunity that we have known from our effectiveness trials. And that is something that we will continue to be monitoring. Those people who are in the clinical trials will be monitored for safety and efficacy for upwards of 2 years. So we will have that information, and it'll be coming, as soon as we have it, it's evolving, we'll be getting that information out to the public. But as of right now, we don't have that exact answer, and I can't answer if it will be an annual vaccine yet or not.
Still a very good answer, and I know I'm not alone when I hope and pray that the immunity from this will carry us much further than just a few months or a year even. So hopefully we'll all keep our fingers crossed and that's where we'll end. Dr. Baligan, there are some clinical questions that I think are really great, and I want to make sure that we address them. So I'm going to ask you several of these in a row. One is, when I get my vaccine, if I'm on different medications, do I need to stop taking those medications prior to my shot?
No. I guess we can go through any number of different medications that someone might be on, but there's no recommendation for stopping a medicine before you get vaccinated. And so it really actually is probably important, if you are on these for those comorbidities that we described, we don't want you to get into a space where you're not on the medicines that you need.
Thank you. And I did want to raise that because I would also underscore, you absolutely do not want to stop taking your regular medicines. You can get the vaccine without having to do that. The next question is about outpatient surgery. Somebody's getting a COVID test 2 or 3 days prior to surgery, as we all know you have to do. And the question is, if I get vaccinated between now and my COVID test, first of all, is it possible that the vaccine would give me a false positive test? And the second question is, should I wait until after surgery to get the vaccine? Your thoughts?
So to the first part, the vaccine would not give you a false positive COVID test. The COVID test is testing for active and current infection. And so if we were doing post-vaccination serology, what we would test for are antibodies, not antigen. And so the two would be two different types of tests, and looking for past infection versus current infection or immunity. To the second part, in terms of should you wait until the surgery to get vaccinated, it becomes a question of, I would say no. It does become a question of the interval of 21 to 28 days. I would imagine for most surgeries, someone would still be able to keep that interval. But if for whatever reason, someone would be incapacitated beyond that interval period and you don't feel as if you'd be able to keep a 21-day schedule or 28-day schedule, then certainly that's something that to address with your provider. On face value, I would say that most providers would prefer you to start the vaccine, and most providers would anticipate that you'd be able to maintain that schedule irrespective of any surgery.
So very helpful. First, don't stop taking your medicines if you're getting the vaccine. And two, if you have surgery planned but have the opportunity and time to get that vaccine before the surgery and know that you can get your second dose after surgery, go ahead and get that vaccine if you have the opportunity. I'm going to ask and answer the last question here, and then I'm going to send this back to Amy to close us out. Will we be able to get the shot if we come to the Inspira hospital? And I'm going to say no, not unless you are registered. Please do not come to the hospital with the idea that you can wait and come in and get the shot. As you've heard today, it is a very tight process. There's a lot of people that have worked very hard to get this right. Standing outside the hospital and waiting and hoping that you can get that vaccine is not your best shot. Not at the hospital, not at the mega sites, not anywhere that the vaccine has been doing. Please follow the processes, register or go online and get the links and put your name down and follow the process. That is probably your best chance of getting the vaccine. And with that, I'm going to turn this over to Amy for her last words for this afternoon.
Thank you, Dr. Coley. I really appreciate our experts taking the time to come and present with you and really have this dialogue. I know, right? It's all complicated, right? You just want it to be easy and you just want your vaccine. I get it. And believe me, we want to give it to you as quickly as possible. We are working as fast as we can with all of our healthcare providers, not just at Inspira, but throughout the state, to make sure that we can get this vaccine out and get it in your arm, and most importantly, to create that herd immunity you've heard so much about today that is going to be the real turning point for all of us. But until we can get there, I'm asking for patience, which I can hear my 91-year-old dad saying, that's ironic because that's the one skill this child does not have. So I realize that that is absolutely something that is not a muscle memory I have, but one I'm working on considerably. Two, please use that COVID-NJ website that Paul talked about. It really is the source of truth right now, and we will continue to use that and update the Inspira website as well. I've heard many people talk about, okay, well, I saw that ShopRite has it. I know CVS is advertising it. Look, I'll tell you what I did for my dad. I'm not saying it's right or wrong, but, I registered him everywhere I could because I want him to get the vaccine as soon as he can. And so I would encourage you to, use that initial website. If you're worried about not getting your email back, please use that 211. But understand, as Paul says, it could take time. And if you hear there's availability somewhere, please make sure you've registered for that as well. None of us honestly care where you get it. We just want to make sure you get it. We understand that these are trying times, and we are here to support you. We are here with our My Inspira app, which you can access through telemedicine. And mostly, we are just tremendously grateful to be your trusted provider in the community. We will continue these town halls on this subject and others as we move forward. I want to thank you for your patience. I want to thank you for your commitment to each other by keeping safe, by wearing your mask, by remaining socially distanced, by staying in your bubble, and by washing your hands, of course. We will get through this. We are strong, resilient people that are not going to be stopped by this virus or by anything else for that matter. Thank you for your commitment. Until we meet again, be well and stay safe.